Okay, so in the last video we were finishing up the setup, but there are a couple more things we need to talk about, right? So we know the principles clash. We saw how that leads to a patient's ability to refuse treatment. So whatever answer we end up giving to this question here, right? Can the doctor ever be justified in overriding the patient's will in order to advance their well-being? Or does the autonomous choice of the patient always win? We want to make sure whatever our principle is, it allows patients to refuse treatments that they do not want, that it allows us to protect kids from the bad decisions of their parents, but we also want to make sure that doctors are not required to give patients futile treatment. So here is another issue where clearly the two principles clash, right? It's the opposite of refusing treatment. Here we have a patient who desires a treatment, and then the doctor doesn't want to provide it. And the doctor may not want to provide it for autonomy reasons or for beneficence reasons. So regarding autonomy, a doctor may not want to provide a treatment that a patient desires because the doctor has control, at least some control, over what they find to be morally acceptable treatments. All right, so if we're going to give the patient all of this autonomy, we can't forget that the doctor also has autonomy. So if a doctor thinks that a treatment that a patient requests is morally unacceptable, right? A treatment is morally impermissible, then given the doctor's autonomy, they should not be required to fulfill the patient's request. What could be an example of this, right? So it could be that a cancer patient is getting desperate and the patient requires that the doctor inject them with experimental cancer drugs. But unfortunately, so far with the experiment, these drugs have had no positive results. And so the doctor finds that submitting the patient to this type of treatment is morally impermissible. Not only is it going to get the patient's hopes up with very little chance of success, so it's going to cause terrible sort of emotional backlash when they don't work, but also the doctor just has some moral objections to experimental treatment in the first place. Right? And so because the doctor is his own person or her own person with the ability to self-govern and make those autonomous decisions, we think they shouldn't be forced to give treatments which they find to be morally unacceptable. But the doctor could also deny a patient a treatment they request because of the duty of beneficence. And so a doctor could know that a particular treatment is futile. And so then the doctor might want to deny the patient that treatment, even if they request it, because it's only going to prolong the patient's suffering, or it could cause them new psychological suffering, right? If they have all this hope that this futile treatment is going to work and they're being irrational, and then all of a sudden when it doesn't work exactly like the doctor said it wouldn't, they once again fall into depression and sadness because their hope was crushed, right? So because the doctor is worried about the patient's well-being, they might deny a patient any futile treatments or treatments that they find to be futile because they don't want to extend their patient's suffering or cause them any new types of suffering. Clearly, we could see this once again with the experimental cancer drug, right? If the doctor says, look, there's absolutely no evidence this works, it's just going to maybe cause you other side effects or bring you new psychological suffering, I refuse to give it to you. Not because I think it's morally unacceptable, but because I'm worried about your well-being as a person, and I don't think it's right to submit you to these types of treatments. It's only going to cause you more suffering. Okay? So that's how the two types of reasoning could go here. So whatever our final principle says, we want doctors to be able to deny futile treatments. Now, there is a problem that we're going to have to discuss, and Robert Schwartz from our readings for the week does a decent job of discussing this issue. When it comes to futile treatments, we need to determine who gets to decide what counts as futile, right? Who gets to decide whether or not a particular treatment is no longer worthwhile? So here are sort of two possibilities, right? We could say a treatment is futile when it would fail to keep the body alive. Or we could say a treatment is futile when it makes no positive impact on the person's health or recovery. So life-sustaining care would be futile in the second sense, right? This life-sustaining care isn't actually making a positive impact on their health or recovery. It's just keeping them alive in the state they are in or in a declining state. But life-sustaining care is not futile in the first sense, right? Life-sustaining care keeps the body alive. So life-sustaining care is not futile under possibility 1, but is futile under possibility 2. So the definition of futility is going to be extremely important here, right? We need to determine what counts as a futile treatment. And so then we have a further, natural question to ask, right? Is it the patient's determination or the doctor's determination when we're worried about futility? If we leave it in the hands of the doctor, they might not think that a low success treatment is worthwhile, and so they might determine that it's futile. But a patient who's more worried about surviving and continuing to live in a healthy state might say, no, that's not futile. Even a 1% chance is a worthwhile risk for me to take, right? So we need to determine whose point of view counts, and then once we know whose point of view counts, what type of answer they could give. So one thing that all of this discussion so far is leading us toward is this discussion about paternalism. Right? Are we ever allowed to override a person's actions or a person's decision-making for her own good? So that's the definition of paternalism we're going to run with for now, right? Paternalism occurs when you override a person's actions or decision-making for their own good. Right, so to get a little bit more clear about this, we override people's decision-making all the time, right? When they make a decision which is going to harm somebody else, we clearly step on their autonomy and say, no, we need to prevent you from harming other people. But that's not paternalism, right? That's overriding their actions or decision-making for the good of another person. Paternalism occurs when it's not for the good of another person. Instead, we're overriding your autonomy for your own good. Right? So an example of this could be a motorcycle helmet law. So your reason for creating a motorcycle helmet law, which requires everybody who rides a motorcycle to wear a helmet, your reason for that could be paternal, right? If you ride without a helmet, you are taking far too much risk with your mental health and your life. And so we need to require you to wear a helmet, and that's for your own good. It's not because we think it's going to have positive impacts on other people or avoid harm to other people. We want you to wear a helmet because it's going to protect you. It's for your own good to do that. So that's a clear example of a paternal law. Okay, so now that you have a rough understanding of what paternalism is, there are some distinctions we need to make. And the first is between weak and strong paternalism. So weak paternalism isn't that controversial, right? We normally accept weak paternalism. Weak paternalism occurs when we override the will of a non-autonomous person or a person whose autonomy is greatly diminished. Right? So in cases where a person is severely retarded, they are depressed, they're addicted to something, or they're acting psychotic, right? In all of those cases, the person is either non-autonomous or their autonomy is greatly diminished. And so we normally think it's okay to override the will of those people, right? We need to, if we can, if it's possible, return them to full autonomy. But given that they don't have the rationality to deal with things properly, we think it's okay to help them, right, for their own good. Strong paternalism is the controversial one, and that's the one we're going to be primarily interested in here. So strong paternalism occurs when we override the will of someone who is substantially autonomous. Right, so this person has at least enough autonomy to make decisions for themselves, and then we're still going to say, no, you can't make that decision. That's not good for you. We're going to force you to make this other decision for your own good, or perform this other action for your own good. So some examples of that, we could give someone a treatment they need, even though that goes against their religious beliefs, because we could believe that death is just bad for anybody. So if your religious belief leads you to death, then we need to step in and do this for your own good. But here, the religious person isn't crazy. Their autonomy isn't diminished or non-existent. They have autonomy. They have their rationality. And we're saying, we don't care still. We need to do something for your own good. Lying to a patient who has a malignant tumor and telling them that the tumor is benign so as to not trigger their fear, anxiety, depression, so on and so forth, is another action where you are acting paternally, right? You are making a decision, you're hiding information from them, and it's for their own good. So as I said, we're worried about strong paternalism. Weak paternalism doesn't seem that controversial. There's also the distinction between pure paternalism and impure paternalism. And this is an important distinction as well. So in cases of pure paternalism, the group whose liberty is being interfered with is the same group who's benefiting from the interference, right? So the person who is feeling some limitation, who we're interfering with their autonomy, gets the benefit. So laws against suicide or laws requiring a helmet for motorcycle drivers count as cases of pure paternalism, right? When you force a motorcycle rider to wear a helmet, you're interfering with their liberty, but they are exactly the same people who are benefiting from interfering with their liberty. Impure paternalism is different. That's where the group whose liberty is being interfered with is not the same group as the group who's benefiting from that interference. So a perfect example of this is if we ban the manufacture of cigarettes, that's going to interfere with the liberty of cigarette manufacturers. But it doesn't benefit cigarette manufacturers, right? We're doing it, we're eliminating cigarette manufacturing so as to protect people from the negative health consequences of smoking cigarettes, right? So the manufacturers actually suffer in this case. The benefit is to some other group, right? So we interfere with your ability to manufacture in order to protect some other group from the negative product that you're producing. Okay, so now that we have a handle on paternalism, that's what we're going to be discussing over the next few video lectures. Right, we want to know who knows best. And often it's said that paternalism isn't justified, especially in cases of doctor-patient relationships, because the patient is always going to be the one who knows best what is in his own interests, right? Who could know better? A doctor could try and disagree with you, right? They could say, no, that's not in your interests. But this seems like nonsense, right? The doctor is not an expert on you. They're an expert on sickness, treatment, so on and so forth. Who's the expert on you? Well, that's just you. You're the best at that, right? You're the only person who could possibly know with as much efficiency as possible what is in your own interests. So we think paternalism in medical cases is probably off the table, not justified, at least intuitively, because you're the one who's the expert on you, and so you know what treatments or what denial of treatments are in your best interest. Now we'll see there's a lot of reason to doubt this. Is this true? Well, at least as children, we don't think so, right? Many children believe it's in their best interest to avoid going to school or studying, but they're just mistaken about that. So people can be bad at determining what's in their own interests, right? This even happens to us as adults. We believe that it's in our interests to go for convenience and pleasure. So we eat far too much, we don't exercise, we smoke, we drink. We believe those are in our own interests because they're bringing us pleasure and we're willing to take the risks. But once again, most of us are probably wrong. We often think it's in our best interest to do a particular task. So for me, I think it's in my best interest to teach philosophy, but maybe I'm wrong, and some placement expert could show me I'd be happier doing something else. So it's not clear that we're always the best judge of what's in our own interest. Maybe we're just as bad as that as doctors, but it also seems like we're probably better than the doctors, even if we're not perfect. Thank you.